I'm welcoming people who are not here, but never mind. Good morning and welcome to our third webinar about lifestyle. My name is Brian Irwin. I'm the CEO of Think Healthy Me, a community interest company registered at the start of the pandemic. I'm also the founder, chairperson of Health and Business in Planet. The strategic group was established in 2018 to address the deprivation of health in Planet. COVID-19 has had a massive negative effect on most of us, with 1 in 4 people suffering mental health problems. I think as families, most of us have experienced mental health. I certainly have. Mental health was high before the pandemic and is now a lot worse. It is dramatically underfunded and under-resourced. We hope that today's webinar will help in a small way towards making a difference, certainly in East Kent. I'd like to welcome you to what we hope to be a two-way learning experience. We have a most diverse audience consisting of people with a great deal of knowledge and experience of mental health in all forms. Therefore, we have designed today to be interactive and have built in 20 minutes for discussion. We want to learn from you by the questions you ask and the practical knowledge you share. I know of at least one person with mental health who is hoping to learn from today's webinar. So the purpose and benefits. The purpose of today's webinar is to gather information and knowledge, to raise public awareness about mental health, to offer training opportunities in mental health, first aid, and other benefits that will emerge from our discussion today. We have 2 Think Healthy Me associates, Jeremy and Sharon, and they are experts at what they do. Well, why not? And you will benefit from what we eat affects our mental health. The research has shown that between metabolic health and depression and much more, and also we hope you will get an understanding of the complexity of mental health, including what we do and mean by mental health and what influences our mental health. So that's me, and I'd like to hand over to Jeremy. I'm just checking my stopwatch. Jeremy and I work together. Jeremy is an associate. He is a civil engineer and has traveled extensively, I believe, at least 11 countries. And he is a fantastic researcher. Hope I don't embarrass you, Jeremy. So I'd like to hand over to Jeremy to do his 15-minute presentation. Over to you, Jeremy.
Okay, thanks, Brian. I'll just share my screen. Okay, can you see that?
Yes.
Yep, loud and clear.
Where have I gone? Right. Thank you for that introduction, Brian. I'm going to not admit to being an expert. I am a civil engineer, though, and I do a lot of research. So this presentation is about diet, mental health, and inflammation, and those words are not normally put together. And there is a connection which is mostly ignored because it's not part of the accepted narrative. This presentation is for information only, not medical advice. So please discuss any dietary changes with your doctor. So the hypothesis is in this presentation, what we eat affects not just our physical health, but also our mental health. And changing our diet can improve both. I've used this quote before in my presentations, and I'll use it again, no doubt. 85% of ill health is due to your diet. What you eat determines on a daily basis how you feel, your emotions, your energy, and whether you're becoming healthier or less healthy. So what your emotions and what you eat are connected. So let's dig into that a bit. Forgive me for jumping in at the deep end with a term like metabolic syndrome. Maybe you've heard of it and maybe not. So the next few slides will try and link metabolic syndrome, inflammation, and mental health disorders. So metabolic syndrome, it's quite simple. Excess fat around the waist, high blood glucose levels, high blood pressure, high triglyceride levels, and low HDL. So for those people who have diabetes, they have metabolic syndrome. And what we eat affects that. There was a study done in America where they measured that only 12% of the population had none of these criteria. And I don't think we're much better off in the UK. And all these conditions are affected by what we eat. There is a study done by the National Health and Nutrition Survey in America, commonly known as NHANES, and they reported that elevated inflammation was significantly correlated with body weight, waist circumference, markers of metabolic syndrome. Research suggests a bidirectional relationship between metabolic syndrome and major depressive disorder. So there's many papers on this one. But also obesity is closely associated with increased inflammatory markers in the liver, fat cells, muscle, and brain. So if you've got inflammation in the brain, that will affect your mental health. The titles of these articles say enough without going into the details. The message from all of them is that depression and inflammation are closely linked. There are many more studies which say the same. The last few slides have shown the connection between physical and mental health. And there are many more like that. The King's Fund provided some statistics on this for England. There's 15.4 million with at least one long-term physical condition, and 10.2 million have mental health problems. And there's an overlap, they say, of 4.6 million with these. And I'm guessing that during lockdowns, both of these numbers have significantly increased. So there's 7 times the risk of depression for those with 2 or more long-term physical health conditions. And you're 2 to 3 times more likely to have depression with those living with diabetes. Now, in England, there's 7.3 million who took antidepressants in 2017, 2018. That's 1 in 6 of the population. And the increase in prescriptions has doubled in the 10-year period leading up to then. But Public Health England, their response is, I think, equally depressing. It's not addressing the root cause, and reading this paper, it's though they've just accepted that they cannot do much to improve the situation, suggesting further research. I think it's important to relate to our current pandemic. This chart was in a paper recently published by the Center for Disease Control in America. I've just put in the top 10 underlying conditions for adults hospitalized with COVID. And as you can see, it's a very large study of over 500,000 patients. Now, the first 4 of these are all criteria for metabolic syndrome. And they split diabetes into 2 groups, those with complications and those without. There's another 60,000 in the group without complications. But also there are entries in the top 10 for mental health conditions, anxiety disorders and depressive disorders. And if we added these 2 together, then the top 5 underlying conditions would be metabolic syndrome and mental health issues. And the remainder in the top 10 are all factors which are affected by lifestyle. So what you eat and also smoking. This paper talked about mental health disorders that are associated with increased mortality from COVID as well, 75% increase, more risk. And all of these points I've talked about so far have just highlighted the problem. So I should start talking about the solution. And yes, there is one. This very short book, which I read on Kindle for 77p, it was, from an Israeli doctor who does practice low carb in her treatments. She says a poor diet with its junk food, ultra-processed starches and cheap fats cause metabolic dysfunction. And nutrition is the biggest coronavirus risk factor that nobody is talking about. I'd really echo that. And very briefly, the American Diabetes Association says that reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving blood glucose. So that'll impact on mental health. And just very recently, and I haven't put it in the slide here, Diabetes UK and the British Diabetic Association have co-authored a paper saying that type 2 diabetes remission should be considered as a treatment goal and included low-carb diets as one of the options. This is a big step forward. Now, Georgia Reed, she's a psychiatrist who practices what she calls nutritional psychiatry. She reinforces the connection between mental distress and diabetes and obesity. But her advice is to get rid of the refined carbs, the seed oils, which we know as vegetable oils, and sugar. It's necessary, but it's easier said than done. And that could be the subject of another presentation. Now also, Chris Palmer, he's another one of the psychiatrists in America who's recognized that diet and mental health have a strong connection. He recently tweeted, metabolic syndrome is more than just diabetes, obesity, and cardiovascular disease. It affects your brain function and it has strong implications for mental health too. and he uses a ketogenic diet as a treatment option. And he says it can be more effective than medications. There's studies on Alzheimer's as well. These are two studies reviewed the ketogenic diet as a potential treatment for Alzheimer's. And this has been talked about more and more. Alzheimer's is often referred to as type 3 diabetes, a metabolic disease of the brain. And these books, two by Dr. Dale Bredesen, another one by Amy Berger, they promote a low-carb diet. The one in the middle with the blue cover, the first survivors of Alzheimer's, that's a book which I haven't got yet, but it'd be lovely to read at some stage. It's people who have recovered from Alzheimer's giving their own story. Let's look at two anecdotes. Dr. David Unwin, who has reversed type 2 diabetes in 100 of his patients. And he talked about an 86-year-old woman in a nursing home who had stayed in her room for months. And she had become confused and lethargic. And when he visited her, he noticed lots of sweets, biscuits, and sugary desserts. He asked her to cut out the sugar. And shortly after doing that, she left her room and joined in with the regular nursing home activities. And the staff said she had come alive again. And my own story as well. I've seen improvements for myself, my own mood, memory, mental clarity. I know they're hard to measure, but I do feel they've all improved rather than declined as I get older. Now, I've been on a low-carb diet for about 4 years now. And finally, the conclusions. There are strong associations between metabolic health and mental health. The first 10 underlying conditions for COVID people in hospitals are all diet related. And they also include anxiety and depression. Ultra processed food, refined carbs, refined seed oils, and sugars are powerful promoters of inflammation, metabolic dysfunction, and mental health disorders. And a ketogenic diet can be a very powerful mood stabilizer and can be a very powerful antipsychotic treatment. So the last slide, I like this from the diet doctor. Ketogenic diet for mental health, come for the weight loss, stay for the mental health. To me, that's 2 for the price of 1. So thanks very much. I'll unshare my screen now.
Okay, well, thank you very much, Jeremy.
Okay, over to you.
Yeah, thank you very much, Jeremy. That was a very, very interesting presentation. And even though I've heard and listened to it before, I'm always picking up new bits and pieces, which is quite incredible. I'd like to hand over to the audience. And if anyone's got any questions, feel free to unmute yourself and you can ask. Elizabeth's got a hand up.
Hi, yeah, Jeremy, that's a fantastic presentation. I thought my head was going to fall off from nodding along with you there. And I was going to mention Alzheimer's, which you covered in your presentation. And obviously there is now evidence that Alzheimer's can be affected by diet. Can you hear me okay? I've got a lot of noise going on here.
Oh, yes, I can hear you.
Yeah, fine.
Okay. So, Jeremy, there is evidence out there now, isn't there, about Alzheimer's?
There is evidence out there. I mean, there's strong evidence that insulin resistance, which is affected by your diet, is not just associated with Alzheimer's, but it can cause all the symptoms of Alzheimer's. So it's not just an association. And as I said in the presentation, Alzheimer's is now being referred to by some as type 3 diabetes. So this morning I was listening, well, I wish I'd been able to listen to all of it, a fascinating YouTube podcast between Dr. Georgia Reed, who I mentioned in my presentation, and also a doctor called Vera Tarman, where they discuss a lot of this as well. Vera Tarman's an addiction food expert, and Georgia Reed is, as I said, the psychiatrist. Yeah, but there is evidence.
Yeah, and it drives me mad as well when I see this. You know, it's been proven as well that anxiety, or people with anxiety and mood disorders, they have one thing in common, which is poor gut health. And
yes.
it's crazy to me. And you mentioned about, you know, the underlying causes for people being in hospital with COVID, and yet they're being fed exactly the food that caused them the problems in the first place.
I might suggest that they've been fed worse food.
Highly likely.
Okay, anyone else got any other questions? And to put to Jeremy?
I was just wondering what sort of oil you recommend if you're going to cook things with oil.
I'm going to reduce that to fats rather than oils. Olive oil, good one for salads. I think Lizzie possibly knows as much or more about this than I do. As I say, olive oil for salads, seed oils, which are sunflower seed oil and rapeseed oil, to avoid completely. And I would suggest not to be heating olive oil. If you want to cook with something, cook with stable fats, which is butter, lard, coconut oil as well. We're too frightened of those fats. We've been made frightened, and we shouldn't be. Lizzie, any comments on that?
Only that you're spot on. Exactly right. Exactly right.
Judith has a question.
Yeah, I was just asking because, like, you were talking about the low carb, low sugars, and low processed foods to help with the mental health. So, what exactly is the ketogenic diet then? What is that different from not eating low carbs, and what's the difference?
Okay, it's really well explained in Georgia Reed's YouTube video with Vera Tarman. She explains it beautifully, so you get a better explanation if you go and listen to her. But essentially, she starts off with what would be a paleo diet, which essentially is no processed foods. Can you all hear me? Yeah?
Yes.
Yeah? Can you hear me? Or have I gone?
No, you're fine, Jeremy.
You can hear me.
I can hear you, Jeremy.
Okay, good. Fingers froze. She starts off with a paleo diet, which is essentially tending towards low carb. You might be having, say, 100 grams of carbs a day, but it's all unprocessed food. So no refined grains, no seed oils, no sugar. Just take those out. But meat, eggs, possibly dairy for some, fruit and vegetables. But for those who want to go strict ketogenic, which is very low carb, they would possibly need to reduce their fruit and vegetables to a very low limit. So if you, and there are people, I mentioned Dr. Tim Noakes right at the beginning of my presentation. Yeah. He was diagnosed with diabetes. It's taken him about 7 years or so to become non-diabetic, but he says he has to do it by going with 20 grams of carbs per day, which is very little, I have to say. So when he says that that's basically some green veg, but no fruit, and yeah. So that would be a ketogenic diet. And in a way, the ketogenic diet is defined by whether you're in ketosis or not. So it actually is, what is your level of ketones in the body? And you won't necessarily be in ketosis with just, say, 100 grams of carbs per day, but you probably will be in ketosis with say 20 grams of carbs per day, but it also depends on the total amount of calories. If you still overeat your calories, you won't be in ketosis either. So one needs to be wary of that.
Okay, well, thank you very much for that, Jeremy. I hope that answers your question there, Judith.
Yeah.
Yeah, okay. I've just noticed the time is 11:31. If anyone's got any other questions, please feel free to email them and we'll pass them on to Jeremy.